How you doing, Dr. Lowe?
Hey, Khaled, how's it going? Good to see you.
Good, good. Good seeing you too. Busy morning so far?
Oh, just got off two different CTV interviews and now spending some time with you.
Awesome. Thanks, man. I
No, it's good
appreciate
to be here. Thanks.
it. So, a lot of questions. Okay, so there is word that the stay-at-home order is going to be extended to June 2nd. Can the stay-at-home order be extended further in Peel?
Yeah, it's really difficult to say. I don't envy our provincial counterparts right now. They got a lot of tough decisions. We know that cases are coming down, but they are pretty much just at the height that they were in April. And then the bigger issue is that the escape valve, because as you know, cases and then a part of those cases, which are become hospitalizations, and a part of those become intensive care stays. And then unfortunately, a number of people also experience mortality. So the reality is that escape valve for the hospitals is not yet clear, right? We still have over 800 people in ICUs across the province. We've got thousands of hospitalizations. So even though the cases are coming down, if they start to go up again and you get more hospitalizations ICU, there's nowhere for these people to go. So I think it'd be really hard for our provincial partners to do anything else other than just really keep things in place so that we can continue to see all the trends resolve.
So, do you think that June will be kind of a stay-at-home order as well?
I'm hoping not, though. That's the other thing. The wild card in the midst of this wave is that we also have our vaccinations that are really coming up. I mean, we know that 40% of Ontarians have already received a first dose as of 2 weeks ago, probably closer to 50% of Ontarians. I know that we in Peel are approaching 50%. It's probably today is actually 50%. I know York and Toronto went just yesterday. So the reality is that more and more people are out there getting their first dose, and the sooner we get to 75% first dose coverage and then start on second doses, the more likely we will also be able to start driving those trends down because more and more people will be immune to the virus. So I think it's a matter of people just need to continue staying at home, keeping their guard up. And now because 18 plus, if you're living in Peel and you're 18 plus, Mississauga, Brampton, Caledon, now is your time to go get vaccinated. Visit peelregion.ca/COVID-19 vaccine to find out how you can book.
What's a threshold that Peel has to meet for you to be comfortable for you to open up in Peel?
Well, the challenge, as you know, Khaled, is it really looks at all the things, right? So the
Yeah.
cases are one thing, but I mean, I got to make sure our hospitals are good. And as you know, both our hospitals, they're still pretty much transferring out patients every day. I think Osler transferred over 100 patients in 1 week, and these are people that are being transferred as far away as Windsor, as far away as St. Thomas now. Like they're running out of places to put people. So I mean, we got to make sure our hospitals are starting to stabilize, and we're seeing the ICUs and wards clearing out in addition to the decrease in cases. And we also got to make sure that our vaccine coverage rates are getting up to 65-75%, which is why we need everyone to do their part. It's all collective action right now. Make sure you're staying home, staying safe as you can, reducing your contacts, and then getting your shot. If you haven't got your shot yet, book your appointment, get your shot.
Patrick Brown, the mayor of Brampton, mentioned this weekend that he thinks that herd immunity will kick in about June. Do you see that happening?
So I think we will definitely get to 75% first doses by June if everyone does their part and gets their shot. But where I think there is some confusion, because the media used this, I don't think it was necessarily Mayor Brown, but the media talk about herd immunity. Herd immunity is actually two doses, right? Because we know that these vaccines are not a one and done. So we will, though, get to the first dose 75% coverage, hopefully in June, if everyone manages to get their shots. And then we've seen how in Israel and the UK, that's where they started seeing some major changes in their transmission patterns. And then, of course, so there's three milestones I talk about. There's the 75% first dose. Then there's the second milestone is 75% first dose coverage, 20% second dose coverage, which is where the UK is right now, and which is where New York is right now, which is where they're basically starting to reopen, but with restrictions and precautions. And then beyond that, to get to herd immunity, you're looking at 75% two-dose coverage, which, my hope is also, I guess there's another message that's increasingly going to be out there. If you haven't got your shot yet, make sure you get your first shot. If you have got your shot already, don't forget to get your second dose when they start second doses, because those will be coming in the summer.
Awesome. Talking about second doses, I got the AstraZeneca. I heard that there's no more AstraZeneca left. Now, I heard that there's a study coming out over the next couple of weeks saying that I might get the Pfizer and Moderna as a second dose.
So the National Advisory Committee on Immunization, which is the federal body that oversees everything in terms of how vaccinations should be used, they're studying all the data, and we know that in the UK there was a study that was looking at mixing doses. That was also a similar study in Western Europe and the US. So I imagine they're looking at all those studies, and they're hopefully going to offer recommendations sometime this month as to what to do. I will say, since we are talking about AstraZeneca, first of all, I'm glad you got AstraZeneca, Khaled. Like a lot of the conversation and rhetoric around AstraZeneca, it's really, really unfortunate. It's a good vaccine. It's a very, very rare side effect. The likelihood of getting a blood clot is less likely than getting into a car accident on the way to the vaccine clinic, because that's actually something that's so I think people are unfortunately the risk and just the conversation has really, I think, confused the public. The simplest thing I can say for everyone in Peel, though, if you live in Peel, if you have AstraZeneca, if you have the opportunity to get AstraZeneca, I encourage you to get AstraZeneca. And then, of course, if there's an opportunity for a second dose shot with AZ, I mean, this is a vaccine that is safe, that's effective. It essentially saved England. So hopefully we can sort of rehabilitate some of the images around that, because I think for the very rare side effects it has a huge benefit and upside in helping us control COVID, not just here in Canada, but also a lot of countries around the world, like poor, lower middle income countries that are really facing challenges. They're going to be relying on AstraZeneca too, because that's the one that's been made available globally. And I just think it's very unfortunate, the rhetoric around AstraZeneca. Sorry, that was a bit of a long answer, but
oh, no worries, no worries, no. I prefer long answers. Peel in Toronto has been allocated 50% of the vaccines, but that expires next week. Now, is Peel going to make an effort to get more vaccines?
So we're continuing our conversation with our ministry partners. They know our significant challenges in the region of Peel. And you're right. I think this week we've been able to increase staff. We've been able to increase operational hours. Caledon East, for example, was doing 400 doses a day. They're now doing over 1,400 doses a day. So we've added 1,000 more appointments there. We've reconfigured our clinics on Wednesday, or I think it's Wednesday or Thursday. Save Max and Paramount Fine Foods are going to 7 a.m. to 11 p.m. We're actually trialing an overnight shift at one of our clinics, but it's being marketed as doses after dark. But we're trying. Yeah, we're trialing an overnight shift there as well. So we're bringing on new hours, new capacity, new appointments to just try to get this vaccine out as quickly as possible, because we know the demand's out there. And so, yeah, I think the ministry knows, and we'll see what happens. We know more vaccines also coming to Canada all the time. So we'll have to see where we land in terms of ongoing allocations for the back half of May.
Okay, perfect. 12 and up vaccinations, or I guess 12 to 18. Do you think, when do you think kids will start getting vaccinated?
Province has a pediatric table that's looking at this right now. I know that they're very seized with trying to get this age group eligible sooner rather than later, recognizing that the more people get protected with the first dose and then eventually second doses, then the more people, the quicker we'll get to interrupting transmission levels. So I know the province is actively discussing it. I'm hoping that more details will be released shortly.
Okay, awesome. Schools, do you think they'll be closed for the rest of the year for in-class learning?
Well, again, it really depends on all the trends. Like if our hospitals start to clear out, if the cases start to come down, and we're seeing, I think today we'll probably hopefully see more of the measures working and more cases coming down more quickly, along with immunization coverage, and maybe you start vaccinating some of those 12 to 17-year-olds, then it is possible that maybe a phased return, who knows what might be possible, because we do know that children do benefit tremendously from in-person learning. But it will remain to be seen where all those trends go: cases, hospitalizations, immunization coverage.
Okay. We noticed a lot of the business closures have been in Mississauga. Have these business closures impacted, the numbers positively in Peel?
Yeah, I think we're starting to see it in our cases that are reported to us through our system. We were having, our outbreak investigators, our case management and contact tracers, they've been working full bore for 15, 16 months now. But just over the last few weeks at the height of the third wave, it was absolutely challenging, just the sheer number of cases we were getting. There was definitely a bit of a reprieve over this past weekend, which I think reflects both the stay-at-home order, the move to in-person learning and the continued in-person learning, and then a lot of the business closures that have taken place so far.
Now that this list is public now, right, on the Peel Region website, over the last 14 months, have you guys closed this many businesses and just didn't tell us?
No, this is no. In fact, this is actually just a reflection of the expedited nature of the closure. So, as you know, in previous with the wild type coronavirus, we were able to oftentimes contain the virus through infection prevention and control measures, our outbreak investigations, sending bits and pieces of places home. But the reality is that we are now moving to expedited closure, where it's like you got 5 cases, we're closing you. So that's why there's a that's why the sheer number of closures is just that much more, because it's we've set a very low threshold to move to closure nowadays.
Okay. There's quarantine hotels they have COVID outbreaks. We've learned. Are you worried about this?
Well, I think the important thing around any sort of travel quarantine is that that is really meant to prevent introductions into our community. We know that, of course, community transmission continues to be our biggest concern in terms of our current wave. But as we start to bring this under control through measures and through vaccines, and we start to return to some sense of normalcy, it will be very important, especially as many other places in the world don't have this under control right now, unfortunately, that we will need to figure out how to make sure our quarantine hotels are both protecting their workers, but also protecting Canadians by ensuring that that border measure stays strong.
Okay. And are you worried that once the province starts opening, kind of, other regions into red zones and stuff, that Peel will be banned from going into other regions?
I think it's too early to talk about reopening, because it's not really even clear what the province is going to be doing, or whether they're even going to be using the same framework once we exit. I think what is clear, though, is that we will be exiting into a different world with hopefully increasing first dose vaccine coverage, not only in Peel, but across the province, more and more second doses, protecting priority populations like our healthcare workers who just got prioritized for second doses. So it may be a very different roadmap, and it may not be the colors that we're used to. If it is the colors we're used to, then I imagine it will be hopefully be gradual, to make sure that the next time we exit, it will be the last time that we exit, and really just following the path that Israel and the UK have taken, and just leaving measures behind altogether.
Perfect. Last question. Let's talk about the after hours rave vaccination party. Right. That sounds bad. Tell us about that.
Sure. So Doses After Dark is an initiative that Peel Public Health is undertaking. It'll go from Saturday at 12:30 p.m. until Sunday at 8:30 p.m. So it's a 32-hour vaccination marathon. We're going to have some famous physician commentators there that'll be providing vaccines on site, trying to also come up with some prize giveaways. And we're also trying to make it fun, just ensuring that people are having a little fun and trying it out. The actual essence of this is we're also trying to get to some of our vulnerable populations, because we know that there are a lot of shift workers who say that they can't get to our clinics elsewhere, and so we're trying to see what demand looks like for overnight or late evening, early morning kind of hours, so that can actually help to inform our planning as well. So it is meant to reach the younger demographic by trying to make it hip and cool and the coolest ticket on Saturday night. But also we're trying to get to shift workers, working with our transportation colleagues to actually push some of these folks there when they have barriers to transportation, and just seeing if we can actually get demand and use our vaccine in an effective way. So for everyone who's a Peel resident, if you're 18 plus, if you're interested in taking part in this, I encourage you to visit peelregion.ca/COVID-19 vaccine. I know that we released 2,500 appointments today. We're hoping to do 7,600, which would be the largest single clinic that we've done during our entire campaign. And I'm planning to drop in as well, so I hope that I'll be able to see some folks out there and make sure that everyone's doing their part to get their shot and end this thing.
Can you let us know of any secret guests that'll be coming, or any DJs?
So that's all still being worked out, but I would say stay tuned, follow our Region of Peel social, and hopefully we'll be able to announce some famous names as we draw closer to the event.
Okay. So if I throw names, will you tell me? No. No. Okay.
I would, but they might kill me, and then they might not come, which will be bad.
As long as you're there, Dr. Lowe. So.
Yes, yeah, absolutely, Khaled.
Awesome. Well, thanks so much, eh? Thanks so much for being here. Take care. Thanks, Dr. Lowe.